Hello everybody, how are you guys doing? So let's talk about asthma. How many of you people have heard the term asthma? And how common is it? And is it the disease of the lungs, which are the airways, or the intestines, or the skin, or the brain? हमजा भाई ये फ्रिज को So one person has rightly said it is the disease of lungs. So anyone else who thinks otherwise? Skin. Who said skin? Because yes, there is a disease related to asthma, because both are kind of allergic in nature, which can involve skin, but it is not called asthma. That condition is called eczema. ECZEMA, eczema. So asthma by itself does not involve the skin. So skin is not the right answer. So anyone else in the chat who thinks that lungs is not the right answer? And what are some of the symptoms of asthma? Anyone from the stream who knows? Name a few symptoms of asthma. One is shortness of breath. The other most commonly experienced by patients is cough. So these two are the most common symptoms, and there are, if any one of you from the stream knows the answer, can join the chat. So lungs is the right answer. Any one of you who knows the symptoms of asthma and how we diagnose the condition and how we manage it? So any one of you who has a family member suffering from the condition, you would be quite aware of the condition, about its management. And so one person in the chat has said that brain is affected in asthma. So brother, who are you? Please join the chat. I would love to have a talk with you, because asthma does not affect brain. So 2 votes in the favor of brain. Quite amazing. 3 votes in the favor of brain. Guys, this is not the right answer. How asthma can affect brain? Asthma primarily affect, so another vote in the favor of skin. It does not affect skin as well. Basically, there is a condition called eczema, because asthma and eczema both are allergic conditions. So asthma is kind of allergy of the airways, of lungs, while eczema is an allergic condition of skin. Assalamu alaikum. Assalamu alaikum, brother. Walaikum assalam. Walaikum assalam. How are you? Thank you for joining the chat. Brother, how are you? I hope you're doing great. Hello, at the rate married Demer. How are you? And thanks to all who are in the stream. Do you guys have any question regarding asthma? It is called dama in Urdu, what most of the people know. In Pakistan and in India, obviously, most of the people know it by the name dama, but in medical terms it is called asthma. It is pretty common. About 1 in every 10 to 12 individuals is suffering from asthma. It is quite underdiagnosed, and if diagnosed timely, it is undermanaged, and the patients are not quite aware of the condition, so they do not take the management as advised. So they have frequent symptoms, frequent relapses of the condition. They are started on inhalers by the doctors. Few of the common are Combivir, which is a nebulizer, and inhaler is Foster inhaler, Salmicort, Zeltide. So these are a few of the common inhalers being used worldwide. Basically, they have ipratropium, which is anti-parasympathetic. They have formoterol, which is a beta agonist, a sympathetomimic. So the role of these medications is to dilate the airways, because in asthma your airways get narrow, and because of that narrowing you feel the symptoms of asthma. It is an obstructive disease. Basically, there are 2 kinds of diseases in lungs, the most common ones, and they are further subclassified. So the main ones are 2 categories: obstructive and restrictive. So asthma is an obstructive category and an obstructive disease, because inspiration is pretty good, but the expiration is difficult, because your airways, they collapse during expiration, and you have retention of carbon dioxide if it gets severe enough. So there are a lot of votes in the favor of brain, which is the wrong answer. So there are one vote in the favor of intestines as well. So who is this genius? I would like to meet this one. Yes, Muslim. So is asthma reversible or irreversible? Because this is the differentiating factor. Asthma is an obstructive and reversible disease, not like COPD, which is not reversible. So with bronchodilators, your airways dilate and your breathing improves. So we have a test which is called spirometry. So it improves after we give a patient bronchodilator. So it is not the intestines, it is not the brain, and it is not the skin. The right answer here is the lungs. And there are a few triggers for asthma. One is seasonal. In spring season, the burden of pollen is quite high, and in Islamabad, because of the paper mulberry tree, the incidence rises in the pollen season. So there are quite a lot of patients in that season who suffer from asthma, and a lot of people die of asthma, which can be prevented with adequate medication. And most of the people are afraid of, not as afraid from asthma as they're afraid from taking the medication, taking the inhaler, because there is misconception that taking inhaler is addictive, which is contrary to the truth. So this is a major issue which we need to talk about and about which we need to spread awareness. Who is this one person who is constantly, who has joined the stream from the beginning and still with me? Please comment below. I'm waiting for your response. Or are you the one who said I'm going to sleep? Because you were tired? If you are the one, please comment below. Because I'm waiting for your response so we can have a little chit chat. Is asthma a communicable disease? Can it spread from one person to another? So those of you who are in the stream can answer the question. Is asthma a communicable disease? And name a few of the celebrities who have asthma or who are suffering from asthma. Let me name one celebrity. Usain Bolt, the fastest man on earth, is asthmatic. And that shows you that a well controlled asthma does not affect the lifestyle of the patients, and you can live your life as you wish. You can play sports, you can do good in your field, whatever that is, if your asthma is managed appropriately. Because exercise and sports can cause asthma exacerbation. That means that it can worsen the symptoms of asthma. For that, you have to pre-medicate yourself